Okay, so when we when we usually hear about proteins, we think of the food that we eat that has protein in it. No? So usually meaty or the vegetable or milk. But for this afternoon, we will be talking about proteins that are in the blood or in the plasma proteins. Um, Proteins can be, or basically, the basic structure of protein is the amino acids, and amino acids contain nitrogen. Okay, that makes it different from the other chemical substances in the body. And series of amino acids uh, can be considered a protein already, but that's a primary in primary configuration, a linear sequence of amino acid. A protein composed of that will be called in primary configuration. When they start to form helix, like two linear sequences, and then in pairs, that is what you call a secondary configuration or secondary structure in beta sheets. When they try to form now like rods or globules, that is a tertiary configuration. When these globules or rod-like protein structure organize into subunits, that will be a quaternary arrangement, such as your hemoglobin. Okay. So what are the function of plasma proteins? They are plasma protein play a very big part in hemodynamics. Remember in Starling, the Starling forces in the Starling law, that maintains the pressure or the pressure play between the intravascular and the extravascular fluid. Excuse me. Your plasma proteins are also involved in the transport of small molecules. The smaller molecules, okay, they bind to certain plasma proteins for it to be transported either across the membrane or across the vessels. They also promote or inhibit inflammatory reaction. They can be pro-inflammatory or anti-inflammatory as well. There are certain hereditary diseases that involve plasma proteins like your alpha-1 antitrypsin. Ano pa ba? Yan lang muna. Okay. What are the other functions of plasma proteins? They act as buffer. They can also, as mentioned, as in the transport, in the defense, the immune defense of our body, because the immune globulins are also proteins. They can be receptors. They can be clotting factors in hemostasis. As I've said, oncotic pressure. In the structure of many cells and in effect tissues, and practically all parts of our body have protein in it. Okay? And they can also form as catalysts or act as catalysts. In the context of our subject, clinical diagnosis, we measure plasma proteins because we want to use it to either aid in our diagnosis, to confirm our diagnosis, to prognosticate, or to monitor the progress of disease, monitor the response to management, and even screening for diseases. So when we measure plasma proteins, we talk about different methodologies in the field of diagnostics. There are, for each analyte, there can be many methodologies, and some methodologies may be very superior but readily available or cheaper. So you really need to evaluate uh, to evaluate the parameters to be able to choose the right methodology. And that you already learned in the first lecture that we had, like when we talk about sensitivity, specificity, precision, accuracy, and the rest. Okay, there's turbidimetry, there's colorimetry, there's also absorption spectrophotometry, there's dye binding methodology, there's column chromatography, electrophoresis, and immunoassays. You can also fractionate proteins. Electrophoresis is one of the oldest, if not the oldest, of the methodologies or the platforms, and it is actually the reference method of protein determination. And this is electrophoresis is based on the differentiation of the charges of the individual proteins, and this is done at a pH of around 8.6. And based on that, and based on the electrophoretic behavior of the proteins, they are grouped into major and minor plasma proteins. The major plasma proteins are albumin, alpha-1 antitrypsin, and those listed down the line. Serum and urine protein electrophoresis, or rather, not just for serum or protein, any electrophoresis, protein electrophoresis of that, will result into specific migration or movement of the protein in the electrophoretic field. And that characteristic migration of the protein can point to a specific disease. Okay? And that will be affected by the synthetic rates in the liver, or there can be a renal loss and inflammatory state. So that the concentration of the protein can be estimated in the electrophoresis movement of the individual proteins. So the characteristic electrophoretic migration of a protein is specific to a protein, and the pattern, the concentration, will be specific to a disease. Okay? And the major use of serum and protein electrophoresis is to screen for monoclonal gammopathies, specifically the multiple myeloma. Okay. The minor proteins are ceruloplasmin, C-reactive protein, prealbumin, and your protease inhibitors. These are better quantitated or measured using immunoassays. The major proteins electrophoresis, minor proteins usually better quantitated by immunoassays because they don't really migrate. Their appearance in the electrophoresis is not consistent. That's why immunoassays will be a better way of measuring minor proteins. For proteins, we don't need fasting. Okay, there's no need for fasting. So, question: what if a person already has a request for a blood test that requires fasting? Can you do protein determination in such sample? Yes. The ideal sample is serum, because we don't want the anticoagulant, because the anticoagulant has a diluting effect to the plasma proteins, and the dilution might result into a falsely decreased level of a plasma protein. In serum also, there's no fibrinogen. Okay, if you need to identify certain protein, you might need to do fractionation. Measurement of plasma proteins can be semi-quantitative or quantitative. Semi-quantitative, this is by electrophoresis. And as I mentioned, they are just separated according to their electrical charges. And they will migrate into 5 bands. Okay, the alpha, beta 1, beta 2, and your gamma globulins. These bands, as I've said, dun pala sa pattern ng protein behavior, or migration behavior in the media, they're specific, or they will change in certain diseases. For quantitative measurement of proteins, chemical analysis, this is usually using bioret, and immunological reactions. So immunoassays or chemical assays are quantitative. There's an absolute value. As I've mentioned, the reference method for determining the concentration of plasma protein will be dependent on the nitrogen content, and the technique or the methodology is called the Kjeldahl or Kjeldahl. That's Kjeldahl. So it's pronounced without a J. Kjeldahl technique. That will involve the acid digestion of the proteins to release the ammonium ions from the nitrogen containing compounds, which is the peptide or the proteins. Okay. The exact amino acid sequence will allow the accurate calculation. And since patient samples will be containing a mixture of different proteins, and the measurement of nitrogen content is not a simple procedure, Kjeldahl technique is not commonly used in clinical laboratories. This is what the statement there is trying to say, that when you do Kjeldahl technique, you measure the ammonium ions or the nitrogen containing substances. This is just the total protein. You will not be able to, since there's a mixture in any sample plasma. Colorimetric technique is a highly specific method for protein determination, and this is called bioret method. Okay, it uses copper or copper salts in an alkaline solution that will yield a purple complex or purple color. Bioret method is the one that is being used in most clinical laboratories, even in the Philippines, and in many automated analyzers. Okay. Ano pa ba yung mga English dyan? Okay. When we measure proteins or plasma proteins, we measure only total protein and albumin. Globulin is just derived. So total protein minus albumin equals the globulin. And the ratio will be called albumin-globulin ratio. So globulin is the denominator, albumin is the numerator. If there's an increase in the numerator, the ratio decreases. If there's an increase in the denominator, the AG or albumin-globulin ratio decreases. If it's otherwise, meaning the numerator increases or the denominator decreases, the ratio increases. Okay, and this alteration in the ratio will point to specific diseases later in the next slide. Okay, albumin is depressed in certain diseases that decrease synthesis or decrease in intake, such as in malnutrition, malabsorption, liver failure, and other diseases that will have losses of protein either in the urine or in the acidic fluid or in the serous fluid or in the GIT. Globulins, on the other hand, is elevated mostly in inflammatory reaction, be it acute or chronic, because globulins are composed mostly of the immune globulins, which are the antibodies. The lowering of albumin and elevation of globulins tend to occur simultaneously in disease. Okay, thus the age ratio becomes the changes becomes exaggerated. Okay, uh, this is just an illustration of what I've been talking in the past or the earlier slide. An example is a total protein of 80 and an albumin of 55. So what is the globulin? The globulin is 25. Okay. And globulin will be composed of your gamma globulins, beta globulin, alpha 2 globulin, and alpha 1 globulin. This is in in the order of descending concentration. So albumin, the most the highest concentration in the plasma, followed by gamma globulin, beta globulin, alpha 2, and alpha 1 globulin. The gamma globulins are further, have subclasses too. We will go to that in the next slides. Okay. What will be the purpose of protein measurement? I already told you about the 5 reasons that we measure plasma proteins. Ano sabi ko? Either to aid in the diagnosis, confirm diagnosis, and the rest. And that is for certain conditions such as cancer, intestinal or kidney protein wasting syndromes, disorders of the immune system, the liver dysfunction or impaired nutrition, and chronic fluid retaining conditions. These diseases are affected or are changed or affects rather the functions of the plasma proteins. Pero mali yung statement ko. I mean, in these conditions, certain plasma proteins may increase or decrease. Yan. This is an example of the electrophoresis that's done on a normal plasma. So, in the anode or in the positive charge, the albumin will be closer to that. In the cathode, the globulins are nearer to it, particularly the immune globulins. Okay, let me have my pointer. So this is the band that represents the immune globulin. The darker it is, the higher the concentration, such as the albumin. Remember, albumin is the most abundant. And then you have your alpha 1 antitrypsin, alpha 2. So the general bands are, you have your alpha, your beta, and your gamma. And the albumin has its own band, which is the closest or the first on the left side. Yun. The peaks will represent the concentration. I'd like you to look at the gamma globulin or the immune globulin fraction here. There's the IgG, the IgA, and the IgM. IgM is closer to the albumin fraction. IgG, since they're smaller, they are nearer the cathode. In this illustration, this represents the entire plasma proteins. So here you have your pre-albumin, albumin. Okay. So individually you will see them, but if they're too the concentration is too low, you might not see their band here. Okay. Now, total protein can be increased or decreased. So conditions that will lead to decrease in total protein are when there is includes those conditions that will be that there is an increase in the loss of proteins in the kidneys or in the GIT, such as in leakage or if there is malabsorption. Blood contains plasma proteins or contains plasma, and proteins are there. If you lose blood, you also decrease the total protein. extensive burns. Extensive burns because you're losing the plasma there, and also for repair, which involve protein synthesis. Decrease in the intake. Naturally, if you don't take in, then the level in the plasma of the proteins that come or are derived from the dietary intake will decrease. If there is decrease in the synthesis in the liver, there is also decrease in total protein. Or if there is an increase in catabolism, such as in trauma, because of the increased repair activities, then you will have decreased total protein. By the way, the decrease in total protein is called hypoproteinemia. Hyperproteinemia, on the other hand, there are fewer conditions that will result to hyperproteinemia. And one of that actually is not an absolute decrease in total protein, but rather when there is a decrease in the fluid, in water in the blood, there will be a relative increase in the protein. Meaning, hindi naman, the concentration of the protein or total protein in the plasma did not increase. But since there is less fluid, then the measured total protein becomes higher. Okay. But it is truly increased in multiple myeloma, but this is owing to the fact that multiple myeloma will have an increase in the synthesis of immune globulins. Autoimmune diseases also the increase in the production of antibody and even the inflammatory proteins or proteins that are synthesized or that are released during an inflammation or inflammatory process. Neoplasia also can result into hyperproteinemia. What are the challenges? What are the challenges in interpreting protein values, plasma protein values? Well, traumas have said can cause a decrease in the total protein. Infection can increase. Prolonged bed rest. Prolonged bed rest is more on the hemoconcentration. Since the patient has been lying down for a long time, the proteins will be like in the dependent portion. So when you take samples, it might be lower, okay, because you're just getting what's in the surface. Chronic illness also will can increase because this can be there can be an inflammatory activity. In pregnancy also is related to the hemoconcentration because of the impaired blood flow. Medicines such as steroids, insulin, and oral contraceptive treatment or oral contraceptive pill. Lipidemia and hemolysis can impair protein or can interfere with protein measurements. This is how you're going to compute for total the globulin. So an example is 80, 60, then 20 ang globulin. I might ask because this is simple computation. They always say avoid computation, but this is a simple one. So I might be asking questions from that. And then you calculate for the A to G ratio, which is the normal range is 0.8 to 2, and the decrease in AG ratio usually caused by a decrease in albumin and increase in globulin. So in such condition, consider multiple myeloma and autoimmune disease or chronic inflammation. It is increased in cases where the albumin is did I say increased albumin kanina? In the decreased AG ratio, there is a decrease in albumin, increase in globulin. For condition where there is an increase in AG ratio, there is the increase in albumin and a decrease in the globulin or the denominator. So conditions that would have that, the liver disease, hypothyroidism, high protein diet, and in AIDS. Okay. We start with the first plasma protein, albumin. This is synthesized in the liver and it is most abundant. We talked about that already. It binds to calcium. It also binds to hormone and it can bind to drugs. Drugs that are bound to albumin will have a longer half-life because they are not filtered out by the kidneys. So remember that when drugs are bound to albumin, not all drugs are bound to albumin. If you're going to create your drug, probably for whatever disease, make it bind to albumin so it will have a longer half-life. So when you have renal diseases where there is loss of albumin or protein losing renal disease, make sure to adjust. You have to adjust the dosage. Albumin also, we've talked about this already, regulates the water between the tissues and the bloodstream through the oncotic pressure or the colloid pressure. It is decreased in impaired synthesis in the liver because this is primarily synthesized in the liver. Also, if there's malnutrition, malabsorption, and in hepatic dysfunction. This is decreased also when there is loss to fluid that accumulates in serous lined cavities such as your peritoneal cavity, your pleural cavity, and your pericardial cavity. Okay. Also in protein losing nephropathy and enteropathy. It is increased in dehydration and in prolonged tourniquet application, okay, because of hemoconcentration. Prealbumin, or also known as thyroxine binding prealbumin or transthyretin, is a plasma protein that is synthesized mostly in the liver, around 90%. Okay. This is sensitive. Although this is synthesized in the liver, this is sensitive to the intake of protein in the through the gut or to the GIT. Okay. That is why this is a good marker for nutritional status. So the liver synthesis of this protein is affected by the intake. If you are eating less, the synthesis in the liver also decreases, and this is a short half-life. That's why this is a really good marker for nutritional status. This is decreased, of course, in liver damage and malnutrition. Diba? Two factors: synthesis and, of course, the intake. If this is increased, if the level of this protein is increased, there is this is an indicator of the risk of mortality and hospitalization for patients who have infections. Next is alpha-1 antitrypsin. This is produced or synthesized in the lungs and liver, and this is an acute phase reactant. In inflammatory conditions, this is increased. Okay, because they can be present in neutrophils, and they neutralize enzymes, particularly proteases. In the lungs, if this is deficient, the lung the lung parenchyma can have necrotic changes. Okay? So, since this is an acute phase reactant, in inflammatory, you just had your inflammation in your patho A. In inflammation, there is an increase in acute phase reactants, and since this is an acute phase reactant, it is increased in inflammation. It is decreased in emphysema and juvenile hepatic cirrhosis because of a decrease in synthesis. This is an illustration of how alpha-1 antitrypsin protects the lung from the elastase produced by the neutrophils. Okay, it is also When alpha-1 antitrypsin trapped in the liver can also cause liver damage. Sana tayo. We go to alpha-2 macroglobulin, the largest major non-immune globulin protein in the plasma, because your IgM are also large. Okay. Women have higher levels of alpha-2 macroglobulin because of the effect of estrogen, or as a response to estrogen. They are exclusively found in the intravascular spaces. You do not see alpha-2 macroglobulin extravascularly. It inhibits proteases of the walls against the wall of the vessels, kaya nasa loob lang siya. It is increased in nephrotic syndrome up to like 10 times, and in diabetic nephropathy. There is no known disease that causes a decrease in alpha-2 macroglobulin. Dali lang. Wait lang. Okay, sorry. Next is haptoglobulin. Haptoglobulin is in the alpha-2 region, and haptoglobulin binds to hemoglobin to prevent its excretion out of the kidney. Since hemoglobin, or any protein for that matter, should be kept in the body, hemoglobin, for it to prevent it from being filtered out, it binds to haptoglobin. So in conditions where there is increase in the free hemoglobin in the plasma, level of haptoglobin decreases because of consumption, because they are bound to hemoglobin. Okay, so what are those conditions that will have a decrease in haptoglobin? Intravascular hemolysis, hemolytic transfusion reaction, anything that would cause hemolysis, because hemoglobin is inside the red blood cells. Okay, it is also decreased in liver disease because this is synthesized in the liver. It is increased in conditions where there is stress, infection, acute inflammation, or tissue necrosis, because synthesis is stimulated. But these conditions doesn't really involve hemolysis. But if the infection will involve hemolysis, or will bring about hemolysis, such as like malarial infection, then haptoglobin can decrease. Okay. This is just speaking generally. Okay. So another is transferrin. Transferrin is involved in the iron transport, okay, to prevent also its loss. So kanina haptoglobin to prevent the loss of hemoglobin. Transferrin also prevents the loss specifically of iron. Okay. So when iron level is increased, iron level in the plasma is increased, most of the transferrin will be bound to iron. It decreases its level. The level in the plasma will be decreased. And if there isn't enough iron, such as in the case of iron deficiency, transferrin level is increased because there isn't much iron to bind to. Okay, so in hemochromatosis, chronic illnesses, transferrin is decreased. Transferrin actually has become an inflammatory marker also. Okay, So we go to complement. We have 17 minutes. We go to complement. Complement, components of complement are proteins. Okay, so C3 can be measured, and C3, or the representing the complement, would be increased in an acute inflammation, because this is also considered an acute phase response. I mean, uh, sorry, I'm kasi nag-text. Excuse me for a while. Sorry, class. Okay. So, C3 will be decreased in autoimmune diseases because of the activation of complement, and this results into consumption. Okay. In assessing disease activity of certain disease like rheumatoid disorders and SLE and RA, rheumatoid arthritis, a decrease in the complement may help in the monitoring of the progress of the disease. Fibrinogen. Fibrinogen is part of the coagulation factors, or the clotting factors. This is in fact the most abundant of the coagulation factors. So in inflammation and trauma, there is increase of fibrinogen, and that increase in fibrinogen can have an effect on the ESR. I don't know if you already discussed the ESR, but this is one of the activities that we might be doing in the laboratory. I'm not sure if it's going to be in CDP. Okay, fibrinogen will delay the settling of the red blood cells to the bottom. Okay, when you do ESR, you let a whole blood settle in with anticoagulant, settle, and then proteins, particularly fibrinogen, delays the settling of the red blood cells. So if there is a delay in the settling of the red blood cell, or an increased rate, or a high ESR, this is indicative of an inflammatory reaction. Okay? Very nonspecific, but very sensitive. Okay? Acute coronary syndrome and pregnancy also, and oral contraceptive pill use will also result into an increase in fibrinogen. An extensive coagulation because of consumption results into a decrease in fibrinogen. Okay, we now go to the minor plasma proteins, and first will be ceruloplasmin, and ceruloplasmin is synthesized in the liver. That migrates to also in the alpha-2 globulin band. It is copper-containing enzyme that will impart a greenish color to the plasma if it is elevated. Okay, when will ceruloplasmin be elevated? In acute inflammation, because this is considered an acute phase reactant, in malignancy and pregnancy, also in oral contraceptive use. It is decreased in Wilson's disease or Wilson disease because of consumption. Hemopexin. Hemopexin is in the beta band, and it binds heme that is released by hemoglobin to prevent it from being filtered out or being excreted. So, ilan yung meron tayong plasma protein that binds to hemoglobin, meron tayong plasma proteins that binds to iron specifically, and there's also that will bind to heme. So, that is called hemopexin. So, hemopexin is increased in muscular dystrophy, in melanomas, and in diabetes. It is decreased in liver failure because of decreased synthetic activity, in urine loss, and intravascular hemolysis. Intravascular hemolysis, all of those that bind to heme, hemoglobin, or iron, to hemoglobin and heme will be decreased. The hemopexin and haptoglobin will be decreased if there is an increase in hemolytic activity. In porphyrias, in rhabdomyolysis, and chronic neuromuscular disease, because myoglobin also contains heme. Okay. C-reactive protein. C-reactive protein binds to bacteria and fungi during opsonization or for opsonization. That is in the phagocytosis, di ba? Now, in viral infection, it doesn't bind to C-reactive protein. Okay, so this becomes a good parameter to differentiate between bacterial and viral infection. And the good thing also about this is very sensitive to APP. When you say APP, that pertains to an that would mean that a positive APP, there is an inflammatory reaction going on. Okay. Ano na nga yung sinasabi ko kanina? It rises, this is good indicator for bacterial infection and inflammation, or the inflammation that also result from a bacterial infection, because it rises within 2 hours. Okay, and it can be very high, up to 50,000 fold, and it peaks on the second day. Okay, so maganda siya, no? Even before having really the rise in the temperature, when there's infection, you can already pick up that there is a bacterial infection. Alpha-fetoprotein. This is a plasma protein that is seen during pregnancy in the fetus starting at 13 weeks and waning off at 34 weeks. The function of alpha-fetoprotein is to protect the fetus from immunologic attack, and it also modulates cell growth and in the transport of steroids. And this is also needed in the development of female reproductive system. So this is present in the this can be present in tumors of germ cell tumors. Okay. It is increased in pregnancy where there is spina bifida or spina bifida, in conditions where there is neural tube defect, not neutralized, neural tube defect, in fetal distress, and in hemolytic disease of the newborn, and in ataxia telangiectasia. In hepatocellular carcinoma and gonadal tumors, this is also increased. Okay, this is why this is a good marker for those tumors, and you can also use the level of this plasma protein to determine the response to therapy or treatment of that particular malignancy. It's being called protein. And this makes it a tumor marker. This is a tumor marker when used to screen or monitor for these malignancies. We go to globulins. Globulins will be increased in conditions where there is an increase in antibody production, because globulins is composed mostly of the gamma globulins, immune gamma globulins. So conditions like multiple myeloma, lymphoma, leukemia, and even hemolytic anemia. Autoimmune diseases also like rheumatoid arthritis, SLE, autoimmune hepatitis and sarcoidosis, kidney disease, liver disease, and even tuberculosis, globulins will be increased. But characteristically, if there is an immune deficiency, such as in AIDS, globulins will be decreased. Okay? Myoglobin is a large molecule. This is present in muscles because muscles need oxygen, and myoglobin is a strong affinity to oxygen. That also makes muscle not very sensitive or resistant rather to transient hypoxia because of the myoglobin. So they are increased in conditions where there is myolysis. Okay, when muscles die, and these are present inside the muscles, these are released. Okay, so such as in myocardial infarction, malignant hyperthermia, because malignant hyperthermia will result into myolysis, muscular dystrophy, skeletal muscle damage, such as in trauma. So this is the culprit in many of the hazing victims. So sobrang pagpalo, no, results in myolysis. And the problem with myoglobin, they get trapped in the kidneys, causing acute renal failure. So many or most of the victims of hazing die of renal failure from the myoglobin. Okay, gamma globulins. I've said they are immune. These are the antibodies or the immune globulins. There are 5 subclasses: GAMED or immune globulin GAMED, IgG, IgA, IgM, IgE, IgD. You know already the structure of that. These are the illustration here, and they are joined by short and long chains, and these are joined by disulfide bonds. Gamma globulins are increased in multiple myeloma, liver disease, infection, autoimmune disease, and in allergy. In those conditions, there is an increase in production of antibodies. Okay. They are decreased in immune deficiency, in ataxia telangiectasia, and decreased in protein synthesis because these are proteins. Okay. Multiple myeloma, this is a disease that we're going to discuss because this usually comes out in OSPE, because this disease also has radiologic finding. Okay, that's already a tip. So, in multiple myeloma, bone marrow biopsy will yield clonal plasma cells. Plasma cells, remember, produce antibodies. Okay. More than 10% in the presence of the plasma cell in the bone marrow. This is diagnostic of multiple myeloma. And there will be an increase in monoclonal protein produced by the clonal plasma cells, either in the serum or in the urine. Okay. And this is, CRAB is the clinical manifestation of multiple myeloma, wherein there is hypercalcemia due to the osteolysis, renal insufficiency, anemia, and bone lesions. Okay. This is a biopsy of bone marrow biopsy. Look at this cell. This cell is a plasma cell. Another plasma cell. The typical plasma cells, but many of them are plasma cells, and this comprise more than 10%. So if this is a bone marrow this will be diagnosed as multiple myeloma. This is the bone marrow, or this bone marrow biopsy will be diagnosed as having multiple myeloma. Electrophoresis will show a spike in the gamma globulin. Here, this is the gamma globulin here. The albumin even higher than the albumin. X-ray will show punch-out lesions. That's characteristic of multiple myeloma. Punch-out lesion. Para siyang binutasan ng conductor. Okay, and since there are proteins in the plasma, this results to the rouleau formation, or the coin stacking of red blood cells appearing like stack of coins. Okay, iyan, yung parang sausage like na, no? This is called rouleau formation. We've already talked about electrophoresis, so I will not. This is just to show you these different patterns of the albumin alpha 1, or the different bands rather. Okay. Alam nyo na yan. Okay. Just to show you this one, because this might be shown to you during an exam, and this is characteristic of multiple myeloma, and this is polyclonal gammopathy. Okay, different from the multiple myeloma here, because multiple myeloma is monoclonal. Your polyclonal gammopathy will involve these bands here, all the immune globulins. Okay, I think we shall start. Okay, ito yung sinasabi ko, when you get this tracing, you want to know which immune globulin is increased, and that is done by doing immune electrophoresis. Okay, first, the first one here is anti-human, making sure that the immune globulin being detected are indeed of human origin, and the B will be for anti-IgG, IgA, IgM, anti-kappa, and anti-lambda. Okay? Hindi na natin because the first two sections I did not discuss na yung mga acute phase reactants. So we will stop at the immune electrophoresis. Okay? So we end just on time. I will give the PowerPoint to Bonnie. And are everybody here? Dumating na ba si